The Apollo 2 standard dynamic mattress is a dual therapy dynamic pressure mattress replacement with a 1 in 2 cell cycle system. The maximum user weight is 31 stone or 200 kilograms. This is to include any bedding and accessories. The mattress is used for very high risk patients, including up to a category 4 pressure ulcer with frequent monitoring and repositioning. For patients below 40 kilograms, clinical judgment should be used to determine suitability. A risk assessment must be performed to ensure the suitability of a patient. For example, unstable spinal injuries, children and patients with reduced capacity, and patients with gross edema when using alternating therapy. The control pump can be used with both standard and junior mattresses and the chair cushion. Once the mattress is placed on the bed platform, ensure the umbilical cord is at the foot end of the bed with the feet symbol facing upwards. It is recommended that straps are secured around the movable sections of the bed frame, making sure that they are not twisted in order to reduce any movement during ingress and egress. Please also refer to your own local policy. The control unit fits on the footboard of the bed or on a firm surface. Attach the air connector tube set to the control unit. Check there are no kinks or trap parts in the bed frame. The CPR dial is rotated to a closed position. The mains cable fits the length of the mattress in an integral cable tidy. Attach the pump power lead to the socket and switch the pump on. On inflation, the pressure settings will flash blue and a short audible alarm will sound. Once they stop, the mattress is calibrated and the pressure setting will be set at level 3. This can take up to 45 minutes. Ensure there are no sharp objects in the vicinity of the mattress. Secure sheets loosely enough to ensure they do not interfere with cell alternation. The mattress cover is multi-stretch, water-resistant, vapor-permeable, and has a high-frequency welded seam. The mattress has a white inner substrate on the underside of the cover, which helps auditing procedures by making staining easy to identify if the cover has become compromised. There is also a fully concealed zip, which reduces the possibility of fluid ingress and aids infection control. A 1 in 2 cell cycle over a 10-minute period, ensuring that 50% of the patient's contact area is supported, whilst the other 50% has optimum pressure relief. There are 3 static head cells giving the head full support. This is better tolerated by patients who find the movement in the mattress difficult and eliminates any feelings of nausea. The individual cells are of an air-on-air construction, which provides a supportive base, allowing the lower section of each cell to remain inflated. The digital control panel on the pump contains a low pressure indicator, a power failure indicator. The surface type indicator has a therapy choice of alternation and constant low pressure, has max inflate, a comfort range, system ready light, a lock and unlock function, and an alarm mute. Patients can be nursed on the mattress in alternating mode, as well as constant low pressure. The constant low pressure can also be selected for short intervals if the patient is finding it difficult to tolerate the alternating mode. The mattress automatically defaults to alternating mode when it is switched on. To change the mode of therapy, press the desired button and a blue light will illuminate to show which one is in use. Patients can be prescribed both alternating or constant low pressure depending on their needs and the clinical judgment of the carer. Constant low pressure allows the mattress to contour to the patient's body. This reduces contact pressure by increasing the surface area over which the patient is supported. The max inflate mode should be selected when patients are egressing the bed. or rolling from side to side for personal care or moving up the bed. This gives a firm surface for patients to find a purchase. Less assistance is therefore required from the caregiver. When the max inflate is selected, after 20 minutes the system will automatically revert back to the alternating mode. It is a safety mechanism to ensure patients are not left on an overinflated surface. When using the surface type indicator, a blue light will illuminate to show the choice of surface that has been chosen, whether this may be standard mattress, the junior mattress, or the chair cushion. When using the comfort range, please use your clinical judgment when changing the pressure settings. To do this, press the button to increase or decrease the pressure. There are 5 available pressure settings, soft being 10 millimeters of mercury and firm being 50 millimeters of mercury. Each step is 10 millimeters of mercury. A blue light indicates which of the settings is operational. Should the pump be turned off for any reason, it will always return to its default setting of step 3, which is 30 millimeters of mercury. If a patient's backrest is more than 25 degrees head of bed angle and the patient feels that they require more support in the sacral area, please increase the comfort setting. The control unit locks after 2 minutes of inactivity. To unlock, press the lock button for 3 seconds. A blue light will illuminate when the system is locked. The mute function silences the audible alarm. This will restart after 20 minutes if the cause is unresolved. The audible alarm sounds if the power is switched off, or if there is a power failure, or if there is low pressure in the system. Press the alarm mute to silence this. Switch modes from alternating to constant low pressure and wait for all cells to inflate before transporting the patient. Remove the air connector from the control unit, seal with the attached transport cap and turn off the control unit. The mattress stays inflated for up to 24 hours in normal conditions. Rapid deflation of the mattress may be required for emergency treatment or system deflation. In an emergency situation or to deflate the mattress rapidly, please turn the CPR dial to open. Turn the CPR dial to closed to re-inflate the mattress. Wait for the mattress system to reach its optimal pressure prior to returning to normal use. Once the mattress is re-inflated, ensure all the correct settings are re-selected. The Apollo 2 cushion can be used as part of a 24-hour plan of care. If using the chair cushion, please ensure that the mattress is placed in transport mode so that it stays inflated whilst the patient is sitting out. 90 seconds inflation time, a maximum patient weight of 115 kilograms, which is 18 stone. The chair cushion comes in 2 sizes, 18 inches and 20 inches. The 18-inch cushion has 9 cells and the 20-inch cushion has 10 cells. The chair cushion has straps that attach to the chair to avoid any slippage. The air connector tube fits directly into the pump for inflation. The chair cushion cover is multi-stretch, vapor permeable and water resistant. The chair cushion has a white inner substrate on the underside of the cover, which helps auditing procedures by making staining easy to identify if the cover has become compromised. Continence products may be used, however the mattress or the chair cushion performance may be compromised due to the reduced effectiveness of the alternating pressure redistribution.